Kali carb, whenever you are going to think about Kali carb is your potassium, salt of potassium, and this is your first paragraph of your boric materia medica. What boric says about this Kali carb? The weakness is characteristic of all potassium salt is seen in specially in this with soft pulse, coldness, general depression is very characteristic. Stitches which may be felt in any part of the body or in connection with any affections. So basically, if you are going to look towards this remedy, weakness come up in a picture. Okay, weakness you will see in the picture. There is lot of weakness. Weakness. How you are going to understand that there is a weakness? There is a soft pulse, coldness, general depression, and very characteristic stitching pain, which may be felt in any part of the body or in connections. Okay, connections with any affections. All Kali pains are sharp and cutting. Sharp and cutting pain, nearly better by motion. Nearly all better by motion. Okay, any anytime you are going to have that pain, they will better by motion, and always there is sharp and cutting pain as if it has been cut. Okay, and sharp pain are there, but we should not use this remedy or never use any salt of potash where there is a fever, said by TF Allen. Okay, we should not use this remedy in any type of fever. Okay, this is said by TF Allen. Now, what we need to use in fever? Okay, what happen if patient is going to get fever, and you need to remove that sweat and chill and heat phase. What you need to do, you can prescribe Ferromid 6x. Okay, that is the specific remedy, or that is a specific prescription where fever is there, and you are not understanding what I need to prescribe over here. You don't have any crocin or paracetamol, you cannot prescribe it. You can prescribe your Ferromid 6x. Okay, sensitive to every atmospheric changes and intolerance of cold weather. One of the best remedies following labor. Okay, this is really sensitive to atmospheric changes. These people, these Kali carp, are really very sensitive to atmospheric changes and intolerance of cold weather. They really cannot tolerate cold weather at all. Intolerance of cold weather. One of the remedies following labor. After labor pain, after labor, you can use this remedy. Miscarriages for consequent debilitated states. Okay, miscarriages for consequent debilitated state, where you are going to find out the weakness of the patient. Okay, you will find that this patient is really very weak. Okay, debilitated state or continuous stress is there, and then debility is occurring. Okay, especially physical stress. Early morning, early morning aggravation is very characteristic. Early morning, at 5 p.m., at 2 a.m., at 5 a.m., at 2 a.m. likewise. Early morning aggravation is there. Fleshy aged people. The people are really aged who are having lot of who are geriatric age group especially, but they are fleshy. Okay, they are stout, they are fleshy with dropsical and paretic tendency. With dropsical, there is dropsies. Okay, dropsies, edematous feeling, edematous fluid collection in your knees, in your joints, or in your abdomen, ascites-like condition with paretic tendency. Okay, patient can have paralysis-like tendencies. Okay, sweat, backache, and weakness. Understand this line. This is really very important. Sweat, backache, and weakness. If you are having these three things, sweating, lot of sweating, backache, and weakness, you can prescribe this remedy without any complications. Okay, and this is the remedy for your backache. If you are not understanding which remedy I should use in a backache, just go for Kalikarp. Throbbing pain, tendency to dropsy. There are throbbing pain, there is sharp cutting pain, there is throbbing pain, tendency to dropsy. Tubercular diathesis, pain from within out and stinging and of stringing characters. Okay, pain from within out. Patient is going to feel the pain inner side. Okay, inside there is pain and within out Within out pains are there, but stinging character, stinging as if honeybee bite is there. Stinging character pain are there, giving out sensation. Patient cannot do anything. Now I have to keep these things aside. I need a sleep. Such giving out sensation. Now patient cannot stand. Now patient cannot really sit. Now patient is not that having um, not having that energy to handle the things. This is giving out. Okay, giving out sensation you will get in this patient. Fatty degeneration, stinging, pain in the muscles and internal parts, twitching of muscles, pain in small spot on left sided. Okay, pain in small spot. Okay, um, on left sided hypothyroidism. Again, this remedy is really important for your hypothyroidism. And coccitis. Okay, coccitis is again a condition where you will get specifically in menopausal age group, or the people who are suffer with the spinal problem. Okay, spine or vertebral column related problem, you will get this condition, and in those you can use this remedy again. Okay. Okay. Wait a second then. Picture चालू आहे, आवाज कमी करू. Mind, the patient is whimsical. Okay, now let me tell you, I had taken up this mind part by your Kent lectures materia medica. Okay, by Kent. What Kent says about the mind. Mind is whimsical. Whimsical means fanciful. Patient is in a fancy. Okay, patient is really whimsical. Irascible means the out of control. The anger is really out of control. That is irascible. Okay, irritable to the very highest degree. These people are really fanciful, very angry, irritable to the highest degree. Quarrels with his family and with his bread and butter. These people can fight with their family, their bread and butter means where they are working. He never want to be alone, full of fear and imagination when alone. These people cannot sit alone. Okay, there is full of fear and full of imaginations when alone. Fear of future. There is lot of fear about future. Okay, what will happen in the future? It is it fine or is it really bad? Likewise. Okay, fear of death and fear of ghosts. These people have tremendous fear of ghost. Okay. Mm. Then, if compared to remain alone in the house, he is wakeful, okay, or sleepless, or his sleep is full of horrible dreams, or he is never at peace, full of imagination and fever. What happens whenever you are going to ask this patient, keep be in house for this night? If you are going to ask your cousin brothers or your younger brother or sister, they cannot sleep well. Okay, these kali people really cannot sleep well. They will remain awake for whole night. Okay, they will be really sleepless, or his sleep is full of horrible dreams. They cannot sleep, or they have a sleep of horrible dreams. He's never at peace. Okay, they will not find that peace, and full of imagination and fear. Okay, and they will full of imaginations and fear. They really cannot sleep. They will awake for whole night. What if the house should burn up? Okay, now understand their imagination. What if the house should burn up? Okay, what if I do this or I do that? And what if these and other things should happen? Okay, anything is going on their mind. Anything. You really cannot imagine what these people can imagine. Okay, such strong imagination will be there in their mind. He is oversensitive to everything, sensitive to every atmospheric changes. He can never get the room just exactly right temperature. Okay, these people really don't find a room where right temperature is there. They really feel cold, or they really feel hot suddenly, or they really don't find the things properly. Okay, he is very sensitive to every draft of air and to the circulation of the air in the room. Okay, try to understand. It means they really, when a room is a room, for example, you are going to put on the fan in your room, and after fanning you will feel that air. Okay, so they cannot tolerate that air properly. Every sensitive draft of air Okay, what do you mean by draft? Draft means a sudden thirst of the air on your or on your body. Okay, if you are going to sit at the window seat while traveling in the bus, okay, you will get that draft of the air on your face. Okay, so such drafts really lead to a lot of problem. These people cannot tolerate drafts at all. Okay, even he cannot have a windows open even in a distant part of the house. These people cannot tolerate windows open. Okay, because the cold applications and cold things and cold air will really leads to a lot of problem. Okay, so what happened, he cannot have the windows open even in the distant part of the house. He will get up at night and bed and look around to see where that draft of air is come from. He complains that the worse in wet weather and in a cold weather. What happened? These people really get up at night in bed. Okay, they will look around हवा कहाँ से आ रही है, okay, where this draft of air is coming from. His complaints are worse in the wet weather. This rainy season, this wet weather, there is really problematic condition. Okay, in wet weather there is lot of problem, and cold weather there is lot of problem. These people cannot tolerate air in their room. Okay, they just need air for a breathing, otherwise they cannot tolerate air. Okay, they feel so cold that they really cannot handle the cold environment at all. We'll move further. Pains. Okay, now pains. He is sensitive to the cold and always shivering. His nerves feel the cold. They are all painful when it is cold. The neuralgia shoots here and where and there when it is cold. And fit and if the part affected kept warm, the pains goes to some on the other place. All his pains change place goes into the cold part. He covers up the part and pain goes to the uncovered, but the part which is remain uncovered. What happened? They are really very sensitive to cold. Okay, and there is always shivering. There is always chilly feeling. These people are highly chilly, huh? Just like your hyparsal, your cilicia. His nerves, feet, and cold. Their feet become really cold. They are all painful when it is cold, and the neuralgia shoots over here when it is cold. Neuralgia come up in the picture whenever there is a cold feeling. Okay, so what they try to do, they will cover the part. Okay, which is uncovered part, where uncovered part get pain, so they will cover the part so that coldness will be not there, and they will relieve with the pain. Okay, they will ameliorate that pain. But what happened, the part which remain uncovered, on that part pain again started. This remedy full of striking, burning, tearing pain, and this fly around from place to place. Of course, the kalikar has a pain that remain in one place, but usually pain flies around in every direction. Pain cutting like knives. Okay, pain like hot needles striking, stinging, and burning. This is really important. Now how this pain are. Okay, pain like sticking, burning, tearing pain, and this fly from place to place. Okay, obviously what happened in kali carb, it is said that kali carb, you can show the pain, where are the pain. Okay, with your fingers you can really tell the pain, where are the pain. But what happened, this pain cannot be remain at one place. They flies a lot. Okay, around in direction. Pain cutting like knives. Okay, as if you are going to use knife and you are going to cut some parts. Such cutting pain are there. Pain like hot needles. Some hot needles is around and you are having that pain. Sticking, stinging, and burning pain are there. Okay, we'll move further. These pains are felt in internal part and dry passages, burning in the anus and rectum, described as hot pocket were forced into the passage. Okay, hot pocket were forced into the passage. Try to understand this. This is really important. Okay, burning in the anus. So much of burning that patient feel that hot poker were forced into the passage, burning as if with a fire. Okay, hemorrhoids burn like coals of a fire. This is really important. you will not understand such type of burning. Whenever you are going to get burning, you will first think about arsenic. Okay, but this is really become important part while prescribing. The hemorrhoids burn like a coal of fire. Burning of kali carb is like that of arsenicum. Again, from studying this text will be seen that it is common feature of this medicine to have its symptoms come on 3 or 2 or 5 o'clock in the morning. Okay, as I told you, 5 o'clock, 5 a.m. or 2 a.m. or 3 a.m. In morning aggravation is there. In Kali Carb, the cough will come up, have it greatest aggravation at 3 or 4 or 5 o'clock in the morning. Okay, so 2, 3, 4, 5. At this time, there is aggravation. The febrile state will occur from 3 and 3 to 5 in the morning. The patient who is subject of asthmatic dyspnea will have an attack at 3 o'clock in the morning, waking him out of sleep. He will wake up with the various symptoms and remain awakeful until 5 o'clock in the morning. And after that, a great extent they are relieved. Okay, and after that, this patient really can sleep. So aggravation at morning is really seen in this remedy. Okay, we will move further. Head vertigo on turning. Whenever patient is going to turn from one side to another side, at that time vertigo. Okay, headache from riding in cold wind. Obviously, since second or third slide, we are seeing that cold aggravates like hell. Okay, so there is cold aggravation, headache from riding in a cold wind. Headache comes with the yawning. Okay, patient have that yawning. Okay, patient yawn a lot. What do you mean by yawning? Yawning means, hello guys. Good.
Jambari
Good. Okay. So, such yawning with headache. Okay. Stitches in the temple. Okay. There is stitching pain in your temple region and aching in the occiput. Try to understand. Okay. Patient is going to tell you about your headache. You are going to inquire about headache. How is headache? There is pain. Where? In temples. How are that pain? Pain is as if stitching pain. Okay, and any other thing? Yes, I am also having pain in occiput, but there is aching pain. So this location differs both the pain and sensation differs both the locations. Okay, this become really important. One sided headache with nausea on riding a carriage. Okay, on riding a carriage ameliorates the symptoms, that is your nitric acid, but on riding carriage aggravate the symptom, especially your headache, that is your calicar. Loose feeling in head, gray dryness of hair falls out like fluoric acid. Okay, a dryness of hair and hair going to get fall out. Eyes, there is stitches in the eyes, spot, gaze, and black point before the eyes. Lids stick together in the morning, swelling over upper lid. Okay, like a little black. Now this is again important. Swelling over upper lid. Okay, swelling over upper lid is your kali karm. Swelling over lower lid is your apis. Okay, lids stick together in the morning, swelling over upper lid like little bag, swelling of gabella between the brows. Okay, swelling of gabella in between the brows, in between eyebrows. This part is there, that is called as gabella. At that part, there is swelling. Anesthesia, weak side from excessive sexual indulgence. On shutting eyes, painful sensation of light penetrating in the brain. Okay, on shutting eyes, these people find such type of feelings. Okay, as if light is going to be penetrated in the brain. I will move further. Ear, there is stitches in the ear, itching, cracking, ringing, and roaring. Okay, there is itching, there is cracking, there is ringing and roaring. Nose is stuff of in a warm room. Thick, fluent yellow discharges. There are thick, fluent, and yellow discharges. Post nasal dropping like spigelia. Spigelia also have this post nasal dropping. Again, your calcarea also have this post nasal dropping. Calicarp is there is post nasal dropping, but this thick, fluent, and yellow discharges, and no stuff up in the warm room. Sore, scurfy nostril, bloody nasal mucus, crusty nasal opening. Nosebleeds on washing face in the morning, just like your ammonium carb. Okay, nosebleed. Okay, nosebleed after washing the face in the morning, and ulcerated nostrils are there. Okay, we'll move further. Mouth, gums are separated from teeth. Pus oozes out. There is pus, pyorrhea, apathy. Tongue is white, much saliva constantly in mouth. Bad and slimy taste of the mouth. Throat, there is dry, purged, rough throat. Sticking pain. There is sticking pain in your throat as from fish bone. Okay. Swallowing is become difficult. Food goes down esophagus very slowly. Mucus accumulation in the morning. Okay, there is mucus accumulation in the morning in throat. There is dryness, roughness of a throat. There is sticking pain as if from fish bone, as if fish bone is there in your throat, and which leads to pain. Such type of sticking pain you will going to get in a throat. There is swallowing really become difficult. Okay, patient cannot swallow the things very properly, and food is going down through the esophagus is very slowly, you can feel that. Okay, rectum. Now these complaints again become very important in this remedy in this lecture. A large difficult stools with stitching pain and hour before. Okay, sorry, I had missed this slide, that is about stomach and abdomen, and then we will go to the rectum. Okay, so stomach, there is flatulence, desire for sweet. Okay, these people really loves a sweet a lot. Okay, these people desire for sweet. There is flatulence, feeling of lump in the pit of stomach, gagging, dyspepsia of old people, burning acidity, bloating, gastric disorder from ice water. From ice water they will go to get they are going to get from gastric disorders, they are going to get some
Okay.
uh, because of ice water. Okay, they will get that gastric disorder, especially dyspepsia, burning acidity, bloating, flatulence, and such things are going to be seen there. And again, this patient have a sour vomiting. Okay, constant feeling of stomach were full of water. These people really have feeling that in my stomach there is lot of water, stomach is full of water. There is sour vomiting, throbbing and cutting in the stomach. Okay, there is continuous throbbing pain and cutting pain in the stomach. Disgust of food, these people don't like to eat food at all. Anxiety felt in the stomach. Now this is really become important. Now you will ask how anxiety can felt in the stomach. Okay, so when sudden thing, something is going to come up, and you will feel that anxiety, you will feel something, pain in the stomach, and after that fear is going to get over, then you will feel better. Okay, especially the people who cannot cannot go at high places. Okay, and if they are going to get go in a high places, and if they are going to look down. Okay, they are going to see what is going down. Okay, and at that time they can feel that anxiety in the stomach. Such things are going to be seen. Such things has been proven by the patients and your provers. Okay, there is epigastrium sensitive externally, easy choking when eating. Okay, because esophagus, in esophagus, food is going to go down, but it is going very slowly, so there is choking feeling while eating. Epigastric pain to back. Okay, abdomen, stitches in the region of liver, old chronic liver troubles with soreness, jaundice and dropsy. This is again important remedy for your jaundice and dropsy. Distension and coldness of abdomen, pain from left hypochondrium through the abdomen. There is a lot of pain from left hypochondrium through abdomen. Must turn on right side before he can rise. Okay, this is really become important symptom. Patient need to be turned on right side before he can rise. Okay, and then this really become very important. This abdomen and stomach complaints are really important in this remedy. Rectum, large difficult stool with stitching pain and hour before. Hemorrhoids are large, swollen, painful. Itching, ulcerated pimples around the anus. Large discharges of blood with natural stool. um, Pain in hemorrhoids when coughing, burning in rectum and anus, easy prolapses, like graphitis, podophyllum, itching like ignitia. Okay, urine, there is obligated to rise several times at night to urinate. Patient really need to rise for several times at night. Okay, so that they can pass the urine. pressure on bladder long before urine come, involuntary urination when coughing, sneezing, etc. If patient is going to give pressure on your abdominal viscera, abdominal muscle, at that time this patient will have that coughing, sneezing, and at that time a patient can pass the urine. Okay. Male complaints from caution. After caution, this patient have complaints. Deficient sexual instinct. There is deficient sexual instinct. Excessive emission followed by weakness. There is lot of emission. Excessive emissions which followed a weakness. Female menses are early and profuse, like your calcarea carp, or too late, pale and scanty with soreness about genital. Okay, at the genitals there is soreness, there is pain like soreness, there is scanty feeling, there is scanty menses, there is late menses. Pains from back pass through the gluteal muscle. During menses there is pain from back passes through the gluteal muscle with cutting in abdomen. Pain through left labium extending through abdomen to chest. Delayed menses in young girls with chest symptoms or ascites. Difficult first menses. Menarche become really difficult. Complaints after parturition. Uterine hemorrhages. Constant using after copious flow with violent backache. Okay. Relieved by sitting and pressure. Constant oozing after copious flow. Hemorrhages are like copious with violent backache. Okay. Profuse hemorrhages and there is violent backache. And as I told you in very first slide, this remedy is really important remedy for your backache. Okay, if you are not understanding what I should use, you can use bambuja mother tincture, you can use kalikar for your backache. Okay, this small part become really very important. We have seen some line that this patient are really fanciful and angry, but if you are going to look towards your kali patient, okay, as a kali, as a group, they are really sense bounded, they are really duty bounded, they are really very punctual, they are really very family oriented people. Okay, a very strong moral values are there in the kali people. Okay, so this really become important for such emotional and for such very moralistic people to find out and to prescribe. So the while prescribing this remedy, we really need to understand, is there any backaches, weight or weakness like feeling. Okay, because these three your physical symptoms, physical characteristics gives a um, lot of mm, easy way to prescribe you this remedy. Okay, respiratory symptoms, there is cutting pain in the chest, worse on lying on right side, hoarseness and loss of voice. Again, for ammonia you can use this remedy. Dry hard cough about 3 a.m. with stitching pain and dryness of pharynx. Bronchitis, whole chest is very sensitive. Expectoration is scanty and tenacious. Okay, scanty and tenacious. If you need to find out the, if you need to throw out these expectorations, they are really very scanty and as if stringy. Okay, stringy and tenacious are really very difficult to remove out, but increasing in morning and after eating. Aggravated right lower chest and lying on painful side. Hydrothorax, leaning forward relieve the chest symptom. Expectoration must be swallowed. चीजी टेस्ट. ओके, चीजी टेस्ट रहता है, copious, lot of expectoration, often say expectoration and lumpy expectoration. This lump really become important while prescription. Coldness of a chest, wheezing, cough with relaxed uvula, tendency to tuberculosis, constant cold taking, better in warm climate. This become really very important while prescription in these days. Okay, this is really wet weather and cold weather where you need to prescribe in very proper way. Okay, and then such cold and wet weather can indicate such remedies like dalkamara, this kalikar, again your arnica, this rustox. This really become important. Okay, heart, there is sensation as if heart were suspended, palpitation and burning into heart region, weak rapid pulse, intermittent due to digestive disturbances, threatened heart failure. Okay, there is threatened heart failure, you will get in this remedy. There is weak rapid pulse, intermittent due to digestive disturbances. We'll move further. Back, there is great exhaustion and stitches in the region of kidneys and right scapula. Okay, lot of exhaustion, you will find out a lot of exhaustion in these people. Stitches in a region of kidneys and right scapula. In right scapula and kidney, there is stitching pain. Small of back feels weak. Numbness and paralytic feeling in back. Burning in spine. Like you can prescribe over here guacam. Okay. Severe backache during pregnancy after miscarriages. Hip diseases. Pain in knees and thighs and hip joint. Lumbago with sudden sharp pain extending up to down back to the thighs. This is really important remedy for your backache. Okay. Pain in knees and thighs and hip joint. Lumbago with sudden sharp pain extending up and down back and to the thighs. Extremities, back and legs gives out. Uneasiness, heaviness and tearing in the limbs and jerking. Tearing pain in the limbs with swelling. Limbs are sensitive to pressure. White swelling of a knees. Tearing in arm. White swelling means what? White swelling means there is not a collection of there is collection of your edematous fluid and there is not collection of your blood. Okay, that is white swelling of a knee. Tearing in arms from shoulder to wrist. Lacerating in wrist joint. Paralysis of old people. Dropsical affections. Limbs go to sleep easily. सुन हो जाता है पैर जल्दी से. Okay, tip of toes and fingers are painful. Soles are very sensitive. Itching of great toe with pain from hip to knee and pain in knees. Okay, so this is all about your knee complaints. Skin, there is burning as from mustard plaster. Sleep, drowsy after eating, wake about 2 o'clock and cannot sleep again. And after that, in morning, these people feel sleepy. Okay, modality is worse after caution in cold weather from soup and coffee. In morning about 3 o'clock, lying on left and painful side. Lying on left side and painful side, again it become really very difficult for these people. They get better in warm weather through moist weather during daytime while moving out. These people really get better in warm weather. Okay, warm things become really important for these people. Relationship, complementary carbo wish. Okay, lowness of vitality may suggest preliminary course of carbo to nurse up the recuperation of the point to the point that Kalika would come up in helpfully. It follows the Nux vomica often in stomach and bladder troubles. Okay, so this is all about your today's lecture. We had completed Kali carb today. Okay, anyone has any query, please call me directly, and we will stop over here. Tomorrow I will take about Kali bichromicum. So this is all for today. Okay, guys.
Okay,
Okay,
ma'am.
ma'am.
Yes, ma'am.
Okay. So I will end this meeting over here.
Kali Papa.
Thank you, ma'am.